Today, we are diving into a really critical medical emergency, one where the clock is your absolute worst enemy. We're talking about esophageal perforation. It's a true race against time, where every single minute can be the difference between life and death. So let's get right into it. What actually happens when that tube, the one that carries food from your throat down to your stomach, what happens when it suddenly tears open? Well, the consequences are incredibly severe. And to understand them, we have to know exactly what we're up against. All right, so first things first, what exactly is an esophageal perforation? To put it simply, this isn't just a little scratch or a scrape. We're talking about a complete, full-thickness tear that goes all the way through the wall of the esophagus. It's a hole, a rupture, and it can happen anywhere along that pipe, from your neck right down into your abdomen. And this is where the real danger becomes crystal clear. The best way to think about it is like a major pipeline bursting inside your body. Suddenly, instead of food and liquids going safely to your stomach, they're leaking out. Stomach acid, bits of food, bacteria, all spilling into your chest cavity, a sterile area that is absolutely not equipped to handle that kind of contamination. So how on earth does something this catastrophic even happen? The most common cause might actually surprise you. Believe it or not, the number one cause is what doctors call iatrogenic. That's just a fancy word meaning it happens accidentally during a medical procedure. Things like endoscopies, where a camera goes down the throat, have become so common that, unfortunately, injuries from them are now the leading cause of this condition by a pretty big margin. Of course, there are definitely other, more dramatic ways it can happen. You could swallow something sharp, like a fishbone, or ingest corrosive chemicals. It can happen from severe trauma to the chest, or even, in rare cases, a spontaneous rupture from just violent vomiting. That last one even has a name, Borja-Have syndrome. Now, with a condition this dangerous, spotting the clues early is absolutely vital. It's kind of like a piece of high-stakes medical detective work. So doctors are trained to be on the lookout for a very specific set of 3 symptoms. It's called the Mackler triad. And when these 3 things show up together, it's a massive red flag that they could be dealing with an esophageal perforation. Let's break that down. First, it usually starts with really forceful vomiting or retching. That's followed almost immediately by sudden, severe pain right behind the breastbone. And then comes the third and most specific clue, subcutaneous emphysema. That's air that's leaked out from the chest and gotten trapped under the skin, usually in the neck. People say it feels like crackling, kind of like bubble wrap. And get this, there's an even more specific clue a doctor might find. It's called the Hammond sign. If they listen to the chest with a stethoscope, they might hear this distinct crunching or crackling sound that's perfectly in sync with the patient's heartbeat. It's the literal sound of air in the chest cavity, right where it should never, ever be. Okay, so the suspicion is there. How do doctors actually confirm it? Well, the detective work continues, this time with medical imaging. The first step is almost always a chest X-ray. Doctors are hunting for those telltale signs of a leak. Mostly, they're looking for air in the chest cavity, which is called pneumomediastinum. They might also spot a collapsed lung, fluid building up, or that air trapped under the skin that we just talked about. But here's a really crucial point, and honestly, it's a scary one. A perfectly normal-looking X-ray, especially early on, does not mean the patient is okay. Sometimes the signs just haven't shown up yet, which makes this diagnosis incredibly tricky and ridiculously time-sensitive. So to get that definitive answer, they have to turn to the gold standard test, a contrast esophagography. For this, the patient swallows a special dye, and doctors watch it go down on a live X-ray. If they see any of that dye leak out of the esophagus, boom. That not only confirms the rupture, but it also gives the surgeons a perfect roadmap, showing them exactly where the hole is. Once that diagnosis is confirmed, the race against the clock kicks into high gear. Let's be absolutely clear here. This is a full-blown surgical emergency. The number one goal is to get that patient into an operating room as fast as humanly possible to patch the leak and clean out all that contamination. Now, are there non-surgical options? Yes, but, and this is a huge but, they are reserved for a very, very small group of patients. You have to be totally stable with a tiny, contained leak and have 0 signs of infection. For the vast, vast majority of cases, surgery is the only path forward. It's the only way to close that hole, drain the infection, and ultimately save the person's life. To really understand why this is such a frantic race, we have to look at what happens when treatment gets delayed. The single biggest, most feared complication is something called mediastinitis. This is a severe, rapidly spreading infection that takes hold in the very center of your chest, right around your heart and all the major blood vessels. It's caused directly by all that toxic stuff leaking out of the esophagus, and it is incredibly deadly. And it doesn't just stop there. That infection triggers this devastating domino effect through the whole body. You're looking at severe sepsis and shock, pus collecting around the lungs, and then the final stage, multi-organ dysfunction, where the body's systems just start shutting down. And this all brings us to the single most critical takeaway here. A person's chance of survival is directly tied to how fast that tear is found and fixed. With every hour that passes, the mortality rate just keeps climbing. When it comes to esophageal perforation, speed isn't just important, it is everything. Which really just leaves us with one final thought. In an emergency like this one, when you're fighting infection and shock and organ failure, what's the one precious resource that, once it's lost, you can never, ever get back? Time.